Hi guys, welcome back again for another video. So for today's video, we're going to return demonstration on assisting the client on sitting on the side of the bed or so-called dangling. So first is we need to determine the assistive devices that will be required, the encumbrances to movement, the medications that the client is taking or receiving,
Because certain medications may hamper movement or alertness of the client.
and also the assistant that is required from another healthcare personnel. So prior for the procedure is we need to introduce ourselves, identify the client's identity, and explain what you're going to do and why necessary, and explain also or how the client participate in these skills. So hello po sir, good evening po. My name is Chardotwena V. Bustamante po. Your name po is?
Charlton Manti Bustamante.
Okay, Sir Charlton. So, ang gagawin po natin ngayon is tutulungan ko po kayong mag-sit po sa side ng bed or so-called dangling para po the purpose of this is the client assumes that bago po kayo maglakad or bago po kayo kumain is kailangan po natin gawin ito. So next is we need to perform hand hygiene and provide client privacy. So for the next procedure is we need to uh, position yourself or me and the client appropriately before to move. So first is placing the client on lateral position facing you with the use of assistive devices depending on the client's need. So, pa-close lang po. Then, your hand is on the shoulder, and then the other hand is on the hips. Sir, 1, 2, 3, go. Okay. So for the next is we need to raise the head of the bed slowly to the highest position.
This will decreases the distance that the client needs to move to sit up on the side of the bed.
After raising the head of the bed is we need to place our client's feet and lower legs onto edge of the bed.
This enables the client's feet to move easily off the bed during the movement, and the client is aided by gravity into a sitting position.
Next is stand beside the client hips and facing on the far corner of the bottom of the bed, and then assume a broad stance uh, with one foot the nearest to the client, and then lean your trunk forward to the hip from the hips, then flex your hips, yung knees, and then yung ankles. Then next procedure is we need to move the client on the sitting position using the assistive devices or depending on the client needs. First is place your nearest hand to the client on the under the shoulder of the client.
Supporting the client's shoulder prevents the client from falling backward during the movement.
And then on the other hand is on the both thighs or near the knees.
Support the client's thighs reduces friction of the thighs against the bed surface during the move and increases the force of the movement.
This is you're going to tighten your gluteal, your abdominal, your arms, and then your legs muscle. And then next is pivot on the balls of your feet facing in the desired direction, and then while pulling the client's legs out of the bed.
Pivoting prevents twisting of the nurse's spine.
So, so in a count of 3, we lift our patient. Sir, 1, 2, 3 po. 1, 2, 3, go. And then next is keep assisting or keep supporting our client in a well-balanced and comfortable position.
This movement may cause some clients to become lightheaded or dizzy.
Then next is we need to assess his vital signs such as pulse, respirations, and blood pressure.
As indicated by the client's health status.
And then document all the permanent data.
Record the ability of the client to assist in moving and turning, the type of assistive device if one was used, and the response of the client to moving and turning.